Hey you, this is your tutor nurse Judy. Welcome to Scientia Nursing. We will continue our EKG rhythm series today, and we're going to talk about sinus bradycardia. It is the opposite of sinus tachycardia, and it means a slow heart rate. Sinus bradycardia is a cardiac rhythm characterized by a slower than normal heart rate. It originates from the good old SA note. In adults, it is typically defined as a heart rate of less than 60 beats per minute. While it can be a normal finding in a well-conditioned athlete or during sleep, it may also indicate underlying pathology, especially if it is symptomatic. Sometimes an athlete's heart rate could be in the 40s, and that's okay. Like sinus tachycardia, sinus bradycardia has all the characteristics of a normal sinus rhythm, except that the heart rate is less than 60. The EKG features of sinus bradycardia are: the rate is usually less than 60, the rhythm is regular, meaning the R to R intervals are consistent when measured with a caliper. The P waves are present, upright, and consistent before each QRS complex. The PR interval is normal between 0.12 and 0.20 seconds. The QRS complex are also normal, less than 0.12 seconds. And the morphology is normal, that is, the shape is normal. T wave is upright and consistent. The key points to remember is that sinus bradycardia is a regular rhythm with a rate less than 60 beats per minute. It originates from the SA node. So the P wave are present, they are upright, and they are consistent, like I said earlier. The PR interval and the QRS complex are normal. Always assess the patient for symptoms. Examples of the symptoms could be dizziness, fatigue, syncope, and some other symptoms. This will determine if the bradycardia is clinically significant. The EKG strip looks like this. How do we manage sinus bradycardia? If sinus bradycardia is asymptomatic, that is, if there are no symptoms, no treatment is typically required. You educate the patient about monitoring of symptoms. You address reversible causes. For example, you may need to adjust medication or treat hypothyroidism. But if the sinus bradycardia is symptomatic, you need acute management. For example, the patient may require atropine, which is the first-line medication for symptomatic bradycardia, or transcutaneous pacing if atropine is ineffective and if the patient is unstable. Medications such as dopamine, epinephrine that usually cause sinus tachycardia can be used in this case to increase the heart rate. Oxygen therapy may be introduced, sometimes IV fluids, if hypotension is due to decreased cardiac output. The long-term management could be a pacemaker implantation, and this will help with persistent symptomatic bradycardia to help improve the heart rate. Also, you can treat the underlying causes, like correcting electrolyte imbalance, managing hypothyroidism, or adjusting medication. This brings us to the end of this tutorial. Please don't forget to comment, like, share, and most importantly, subscribe to my channel. Thank you.